Good afternoon. My name is Miranda Strassman, and I will be presenting a PowerPoint presentation on rheumatoid arthritis, or as commonly abbreviated, RA. I will be discussing the following topics in my presentation: the etiology of RA, some of the cells, tissues, and organs that may be affected by RA, early signs and symptoms people may have indicating RA, how to possibly prevent RA, and the short and long-term consequences of RA. The exact cause of RA is not known. RA is an autoimmune disorder. This means the body's immune system attacks its own healthy cells and tissues. RA affects more women than men. 70% of persons with RA are women. The disease occurs between the ages of 30 and 50. The condition is most likely triggered by a combination of factors, including abnormal autoimmune response, genetic susceptibility, and some environmental or biological triggers such as a viral infection or hormonal changes. The resulting inflammation thickens the synovium, which can eventually destroy the cartilage and bone within the joint. The tendons and ligaments that hold the joint together weaken and stretch. The illustration in the middle of the page shows a normal side to the left and an abnormal side to the right, with a person affected with RA and the resulting damage it causes. RA results in a variety of problems. In an adult, the process may progress through destructive and reparative stages. Progression of the disease is unpredictable. Patients may have episodic or sustained episodes of inflammation. Tendon involvement may take the form of tendinitis, triggering and tendon rupture. Nerve compression syndromes and weaknesses are common. The pannus produces more enzymes that destroy nearby cartilage, aggravating the area and attracting more inflammatory white cells, thereby perpetuating the process. The inflammation of the blood vessels in the eyes may result in corneal damage. Symptoms include redness of the eye and a gray sensation. People with RA may develop anemia, which involves a decrease in the number of red blood cells, as shown in the illustration here. Fortunately, for many patients, newer treatments are helping slow the progression of the disease and preventing serious disability. Patients are susceptible to chronic lung diseases, including interstitial fibrosis, pulmonary hypertension, and other problems. Vasculitis involves inflammation in small blood vessels and can affect many organs of the body. The following are some of the most common symptoms of RA. Symptoms may begin suddenly or gradually. However, each individual may experience symptoms differently. Fatigue, tenderness of involved joints, swollen joints, and redness, which occurs over joints when they are inflamed due to the capillaries of the skin being widened by adjacent inflammation. Diagnosis of RA may be difficult in the early stages because symptoms may be very subtle and go undetected on x-rays or blood tests. In addition to a complete medical history and physical examination, more diagnostic procedures for RA may be required. Some symptoms of RA can include affected joints, limping frequently, joint deformity, and as always, early detection and treatment is critical to prevent permanent joint destruction and joint deformity. If you are showing any early signs or symptoms of RA, seeing your healthcare provider will reduce your risk greatly of getting early treatment and help. There are a lot of medications for RA, but keep in mind the side effects. Read them carefully. Surgery may also be an option, but it does carry a risk of bleeding, infection, and pain, as long as a long recovery time. Discuss the benefits and risks with your doctor. RA increases your risk of developing osteoporosis, carpal tunnel syndrome, heart problems, and lung disease. It can also cause long-term problems with bone and joint health, lifestyle disruption, psychological problems, whole body illness, anemia, and rheumatoid lung. In conclusion, talk to your healthcare provider if you are showing any signs or symptoms of RA. Decide what course of treatment is right for you and that you feel comfortable with. Maybe discuss a safe exercise regimen if you do have RA. Maintain a healthy diet, and if you are noticing any signs or symptoms, see your healthcare provider right away. Thank you.